Dual antiplatelet therapy with aspirin remains the standard in current treatment of acute coronary syndrome. Both Ticagrelor, a cyclopentyl triazolopyrimidine, and Prasugrel, a third-generation thienopyridine, have outperformed clopidogrel and received Class I recommendations for use in acute coronary syndromes. The ISAR REACT 5 study was a multi-center randomized open-label Phase 4 trial comparing the efficacy and safety of Ticagrelor with the efficacy and safety of Prasugrel in 4,018 patients hospitalized with a diagnosis of acute coronary syndrome and a planned invasive procedure. Patients were randomized to receive either Ticagrelor with a loading dose of 180 milligrams and then twice-daily maintenance doses of 90 milligrams, or Prasugrel with a loading dose of 60 milligrams and then a once-daily maintenance dose of 10 milligrams. The primary endpoint, a composite of death, myocardial infarction, or stroke within 12 months, was less frequent in the Prasugrel group at 6.9% of patients than in the Ticagrelor group at 9.3% of patients. The main secondary and key safety endpoint was major bleeding, defined as type 3 to 5 on the Bleeding Academic Research Consortium, or BARC, scale. There was no increase in major bleeding in the Prasugrel group at 4.8% of patients, as compared with the Ticagrelor group at 5.4% of patients. The authors conclude that in patients with invasively managed acute coronary syndrome, Prasugrel significantly reduced the risk of ischemic events without increasing major bleeding. Full trial results are available at NEJM.org.